On 27th August 2010, Kenya signed into law a new constitution with the aim of entrenching the concept of devolution of political and economic power to the newly created 47 counties. At the core of this change was a movement of services from a centralized system of government and taking them to the grassroots. One of the key functions that was developed was the provision of health services. Across the country, this news was met by a renewed sense of optimism. For the first time, it seemed that health will be taken to the people. However, 8 years later, it hasn't been smooth sailing.
Ilibidi amvurute mtoto na force. Kamvuruta. Niliumia. Sasa nilipovuruta mtoto kama mabega sasa hataki kutoka. Katingisha fanya mguu hivi kidogo. Ilibidi akamvuruta.
Until today, we do not have the data of how many women died while giving birth during that time. There was no service in the hospitals. Do you want to tell me that there was no man gave birth during that time?
At the heart of Mombasa County lies a community faced with the struggle of accessing good and reliable health care. Each dawn they are confronted by an array of issues.
Nahofia kuwa kama hatutakuwa na kazi ama kuwa na tegemeo jema, itakuwa ni budi kurudi kule tulikuwa tumetoka.
From the age-old problem of drug abuse, inaccessibility of health services by persons living with disability, inadequate reproductive health services, poor policy decisions, as well as corruption all conspire to keep healthcare services out of reach for majority of Mombasa's urban population. Just what is the missing link in County 001? Mlaleo, Kisauni constituency. In this quiet homestead, we meet Benta Uma. She cannot walk properly due to the pain she experienced during her childbirth.
Nikijaribu simu naitana lakini hakuna mwenye anapokea simu. Sasa uchungu naye inazidi na niko hapa peke yangu, watu walikuwa wameenda kanisani. Sasa ikabidi nimpigie bradangu simu, akakuja kanichukua. Tukamwambia anipeleke Mlaleo kwa sababu Mlaleo ilikuwa karibu na sisi hapo. Nikatoka nikapelekwa Mlaleo. Walinipokea vizuri, ndio ilikuwa ni Sunday, kulikuwa kuna madaktari. Nikapata tu nasi mmoja. Sasa akanipima, akaniambia bado kitu 3 hours ndio nijifungue. Nipige tizi kidogo. Katembea kidogo. Kama sasa tena naenda na mimi mwenyewe nilikuwa nasikia amefika. Lakini sasa yule anasema ndio umeingia, ngoja kidogo. Sasa naambia sister imefika, anaambia bado ndio umeingia. Naonekana bado kitu 2 hours tena ndio ujifungue. Naambia hapana, nimefika. Sasa vile pia alikuwa peke yake. Akanipima tena. Sasa aliponipima akaniambia Benta, mtoto anakuja lakini anakuja vibaya.
Kenya's Ministry of Health says that at least 488 deaths are recorded for every 100,000 live births annually.
We really want to bring change, better change and improve the health sector. We have to start from down there, not up here. But when we always turn our blind eyes so that we just use the resources that we have for what we want to do, then we will be working for ourselves, but we are not working for the community.
This, the ministry says, is a result of women not giving birth under the care of skilled health providers. And in cases where there is a semblance of skilled labor, their numbers are just not enough. But amidst all these teething problems, the Economics and Social Rights Center Haki Jamii, a rights lobby that works with marginalized groups, believes solutions to these problems are attainable with collaborations between county governments and concerned civil society organizations.
So for us, it's that relationship with the county governments, which I think should be better, because we are all trying to ensure communities have the right to healthcare. And also we have most community members that are not aware that health is now a right.
Every financial year, tuna 15% increment ya budget allocation. Hiyo tunaongeza 15% every financial year. It vary because 10 to 15, lakini every financial tunaongeza lowest is 10% ya our budget. Kwa sababu tunaona there's a lot of demanding. Tukiona kwamba pia health is a devolved function.
The inaccessibility of healthcare services and the prohibitive media care costs have forced Kenyans to look for solutions elsewhere. Many put their life savings and hope abroad. Abdallah Mubarak saw his chance at redemption in India after being let down by a series of misdiagnoses in his home county of Mombasa.
Bora nini? Najua vile is very expensive. Wakiangalia ndege, malazi, matibabu, nini. Wende na ukienda, lazima uende na mwenzako mmoja ama wawili. Yani ategemea vile ugonjwa upo nao.
For now, the pain is cooling off, but for Abdallah, he says he did not have to go to India if he got the accurate diagnosis.
Matibabu hapa yako, lakini sasa kule, yani wale wamesoma zaidi kushinda wa madaktari. Hata nilipoenda kule akaniambia daktari wako ni nani, nikawaeleza. Akaniambia kwa nini amefanya hivi. Hii operation ilikuwa itakani hivi.
Health has been commoditized. It's almost like a right that has been left to the market function. The county government, the national government sort of are not doing what they're supposed to be doing to ensure realization of health rights.
We can use that money that is being stolen, that is our leaders are using outside there, to upgrade our health centers so that we also have people from out there who are coming to be treated in Kenya.
As the quest for Mombasa County healthcare increases, people with disabilities are generally forgotten or invisible. And the members of Tunaweza Women with Disabilities know too well how it feels not to be seen or heard.
Also mothers who are going to deliver, like mothers with disabilities. The parents with disabilities who are mothers, they find it a problem to deliver in a hospital because the beds are not adjustable for women with disabilities to deliver at the hospital. Secondly, we have like the sign language interpreters. You cannot find any sign language interpreter in the hospital.
The blind and deaf are just some of those who feel ostracized by a system meant to protect them. They say for them, every visit to the doctor is a trip that lays bare their indignity.
The person with disabilities who are blind, they need materials also to read so that they can know what the doctor has written or what is it concerning health, because they just may sometimes hear but they don't read it by themselves.
At the heart of cost lies another age-old problem: drug abuse and drug addiction, and the constant struggle by those affected in trying to pry themselves loose of the embrace of this vice. At Freretown, over 500 male and 100 female drug users are part of a government treatment program.
Naitwa Sandra Chai. Nilikuwa mteja na sasa hii nakunywa methadone, ni mteja napata nafuu.
Despite the positive impact on Sandra and many others here, they forever walk in the shadow of looming crisis.
Na kunywa methadone kwangu napata challenge nyingi sana, mimi pamoja na wenzangu. Maana tunahofia kuwa kama hatutakuwa na kazi ama kuwa na tegemeo jema, itakuwa ni budi kurudi kule kule tulikuwa tumetoka.
Due to unemployment, hundreds of youth sit here in Kisimani, Freretown, Kisauni after taking methadone. Most of them end up in youth gangs and organized crime.
Na pia vile vile hakuna watu wengi wanaotuthamini mpaka tuwe tuna kazi tunafanya tujitegemee wenyewe. Lakini katika hali ya kuwa tunapata hizi challenge, inakuwa ni shida nyingi sana tunapitia. Hapa tayari ni Kisimani tulipo, hatutakiwi na kila mtu. Ni ile tunakuja tu Mungu atusaidie.
As the stakeholders and county government push for better healthcare in Mombasa County, residents here continue to wait for a new beginning.
Tumeona kwamba county government imefungua hospitali Likoni because tunapoteza watu wajawazito kuvuka huku for operation na delay of the ferry. Now we have a hospital in Likoni, which means in every sub-county we are building a 4-level hospital. Tutapunguza referral kwa Coast General.
CBOs and the CSOs just bash. You see, CBOs and CSOs may bash, yes, but it is good for us also sometimes to sit with the government and have dialogue, because we give our services to the same people.
But amidst all this, a new dawn in the county's healthcare is possible. With proper collaboration, the missing link can be bridged.